Welcome to Snooze Worthy, a podcast by Parenting Practice of Colorado, your window into the world of pediatric sleep, where we explore the science behind sweet dreams, effective sleep teaching techniques, and all the intriguing nuances of your child's slumber. I'm your host, Lindsay Birchfield.
And I'm Paige Legault. Together, we're here to guide you through the labyrinth of parenting, offering insights, strategies, and science-backed advice to make parenting during those early childhood years not just manageable, but truly memorable.
As pediatric sleep specialists, we've seen the transformational power of sleep in countless families.
And because parenting is a journey, we won't stop at sleep. We'll provide you with valuable parenting tips for every aspect of early childhood, from managing tantrums to fostering creativity and hitting those all-important milestones.
So whether you're a seasoned parent in need of a sleep overhaul or a new parent preparing for the joys and challenges of early childhood, Snooze Worthy is your trusted resource. Join us as we unravel the science of sleep, share practical advice, and make parenting truly snooze-worthy.
Welcome back to Snooze Worthy. I'm Paige Legault, and my co-host today is Lindsay Birchfield, and we are pediatric sleep specialists, and we have an exciting guest today, Constance Lewis, who works here at Parenting Practice as a pediatric sleep specialist, but she's more than that. She's also a women's health nurse practitioner and a postpartum coach, and today we're going to talk all about the postpartum period and answer all of your burning questions and how to support you with a better postpartum period. Welcome, Constance.
Thanks. I'm excited to be back again talking about a little bit of a different topic than sleep. So as Paige is saying, I am a women's health nurse practitioner. So I was a NICU nurse for a very long time, then a women's health nurse practitioner. And in that scenery, I did postpartum a lot, actually. I probably saw at least 10 postpartum patients a day. And I learned a lot from that.
Wow.
And so now that I am out of the office setting, I focus on obviously sleep because that has a lot to do with postpartum, but then postpartum coaching. So I coach mommies who had their babies who are struggling with different situations that they need help with. And so I just coach them along the way.
Love that. And we love having you on our team because you just bring so much wonderful knowledge in the space and for our clients. And so let's start by just defining what even is that postpartum period. When somebody said, I'm postpartum, or someone said I'm in, that postpartum period, what does that mean?
Good question. Essentially, when they first defined postpartum, the world thought, okay, it's like the first 3 to 6 months. But then what we're realizing is that postpartum extends well beyond that it actually is now up till about a year, even 2 years. So women can have symptoms anywhere from starting out right away. And then it can last up to, I've seen 2 years. So, but more commonly, it's usually in the 3 months all the way to like the year is where you start seeing postpartum anxiety and depression. But the postpartum period is essentially a year after the baby's born.
Well, I learned something new today, and I have 2 children of my own.
And you're in the postpartum period.
I currently am.
It might go longer than you thought.
Yeah, I got 6 more months, folks. Okay, maybe 2. So tell us what the difference between postpartum depression is versus baby blues, because I feel like baby blues is thrown out here, they're just like nilly-willy, and postpartum depression is like, shh, don't talk about that.
Yeah, so
Something's
true. And
wrong with
also,
you.
something's wrong with you. Like, you're crazy, right? But also, like, it's not just postpartum depression, it's anxiety. So what we always used to call it postpartum depression, right? It's, oh, they're sad, they don't want to interest in anything but really what we're starting to see is that moms these days, because of the pressure of everything in our world that we live in, which is insane that we're doing all this stuff now compared to 50, 60 years ago, not that it didn't exist, but we actually are seeing anxiety now more than, postpartum depression, and both kind of a mix of it. But essentially the baby blues are basically where, and listen to this, 80% of women experience the baby blues. How wild is that?
That's shocking.
Yeah.
Right?
Yeah.
The baby blues. And it's like just hormones that are kind of like, your hormones are up here when you have a baby, and then all of a sudden you have the baby and they're just like, boom, boom. They bottom out. And so
crazy.
it's like, yeah. So your hormones, overwhelming feelings, lack of sleep, stress, and just like the responsibility of what am I doing with this thing? Like, somebody just sent me home from the hospital with this baby and I have no idea what I'm doing.
Zero manual comes with baby.
No. And they're so tiny and fragile, and each baby's different. So even if it's your fifth baby, it still feels so terrifying.
Yeah.
Yes. And it's kind of like a pendulum with the baby blues. Like, and they usually start with the baby blues usually start within a few days, a couple of weeks, but they tend to alleviate pretty quickly. And you kind of settle into your new normal within 2 to 3 months, and you're feeling better and you're feeling less emotional and frustrated, and like the pendulum's going like back and forth. That's the baby blues. When it starts to last longer than just that initial few 6 to 12 weeks in the beginning, and it's kind of just extenuating past that mark, that's when it starts to become considered a postpartum depression or a postpartum anxiety, if you will. So that's kind of the difference. And then also starting to affect your life physically and emotionally in ways that didn't before. I mean, obviously a baby affects your life no matter what. Let's be real. Your husband goes back to work and your whole
Shakes
life
it up
changes.
a little bit.
Just a little. I mean, like everybody leaves you and goes back to their normal life, and here you are like, only my life changed. That's how you feel, I think, sometimes.
Yep.
But when the depression and the anxiety come in, it's just kind of when like you start having physical symptoms and just kind of that emotional toll that keeps going and going and going. So I think that's really the difference. And then the symptoms can be a little bit more severe when you have depression/anxiety. Like the mood swings are more intense. So yes, the symptoms for postpartum depression and anxiety tend to extend a long time. So those mood swings, which are super intense, significant sadness, irritability, worries that overwhelm you, fatigue is a big one. Yes, you're tired. You had a new baby, right? But also I think it's just an extreme fatigue, difficulty sleeping. So in the sense where you're so tired, but you actually can't sleep, right? At all. It's weird. It's like, I'm so tired. Why aren't I sleeping? Change in your appetite. That's a big one. Like you're not eating or you don't want to eat, or you're eating just like every second of the day, just difficulty coping. So those are kind of the symptoms of the differences of the baby blues versus the depression/anxiety.
What about, I keep seeing probably on my social media because I am in the postpartum period, so my algorithm is speaking to me. But what about those thoughts of you're walking down the stairs and you're like, if I trip and fall, those anxious thoughts that just keep running on a loop? How far is too far with that for moms?
That's a great question, because I think that's one of the number one signs of postpartum anxiety is that you're going to have a fear that your baby's going to get hurt. Your kids, your babies, your husband, yourself. Like there's always that fear in women more than men, right? We have a little bit of anxiety about that anyway. I mean, it just is. But when it's becoming significant enough that you can't function, you can't leave your house, you won't get in a car, you won't, it's at least two or
leave your baby with the grandma.
Yes, exactly. So I'll tell you a little story really quickly. I had severe postpartum anxiety with Miles, my first baby, hence why I know a lot about it. And I would have 20 to, I know, I'm like, oh, here we are. We have to experience it to teach it, right?
Yeah, exactly.
Yeah. So I would have 20 to 30 thoughts or images in my brain a day of him dying in ways. Like it was insane.
Wow.
It was like drowning in the pool, falling, and it was so vivid, like blood everywhere, like blue baby. It was just so vivid, and it was all the time. And it was to the point where I did not leave my house for 3 months unless had to go somewhere, like a doctor's appointment or something like that. I was too afraid to leave my house. So that's postpartum anxiety, right? And so yeah, it's normal to have some thoughts here and there, but if it's starting to consume you and it's all day every day, that's a
Yeah, absolutely. And so thank you for sharing those signs and those symptoms. And I think one of the best things that we can do is to educate those around us about these signs and symptoms. So is there anything that you would suggest if somebody is pregnant, they're about to have this beautiful little baby? What should they be sharing with those around them to ensure that if these signs and symptoms happen and they can't see themselves in that space, that support system can step in and help them?
Such a good question.
Yeah, great question. So really education is needs to be at the forefront of any family that is going to have a baby. I mean, even if you're not physically having the baby yourself, even if it's an adoption or a foster or anything, there needs to be education that goes into the feelings that the major care parent will have. Again, whoever's the major care parent it's going to change their life dramatically. Okay. Not that it doesn't change the father's life or, the foster father, but it's just the fact that whoever's life it's going to impact the most, that's the person that is at the most risk of having significant anxiety or depression. So I think that just educating the people around you, and that comes in the part with medical professionals and your parent, if you have your mom and your dad, your friends that have been through it, or even yourself, like, hey, I'm getting ready to have this baby, or we're getting ready to get this baby into the world. Here's a sheet for you of all the signs and symptoms of postpartum anxiety and depression. Can you make sure if I start to show these signs or symptoms that we can find some help?
Yes.
Yeah.
And it's even hard for other people to notice too in the beginning because they're like, ooh, is this just baby blues? Is she just crazy? And they don't want to step on that, stick and crack it because they're like, if I do that, she's going to even go worse. So they're afraid to kind of approach the topic, I think.
Yeah. And it's such a tender time anyways that it's normal to go inward, become softer, move slower, and cocoon yourself into a smaller community.
Yes.
Anyway, so you might not have those extended people around you enough to be like, okay, I'm seeing this as tracking. We've got multiple days in a row. Now we're looking at a couple months. So that's something. When I was pregnant with my first, I was super scared of postpartum anxiety and depression just because of family history. And I was a COVID pregnant mama.
Yeah, same.
So I
think all three of us were.
All three of us were. Yeah. And so it just felt really scary in general. And so we decided to do a bunch of research and come up with a game plan of A, B, and C. So we had our symptoms of what we were supposed to look for. But then we also went a step further of who do we call when we're seeing this? Because my husband is a panicker.
Yeah.
He is going to panic before
he's going to need
anything
support
happens.
as well.
Yeah. So I was like, you need to pick a support person for yourself in order to get yourself, feet back on the ground. Yeah. And that works beautifully. And it worked really well. And I was really lucky. I didn't have anything severe enough that I needed additional support, but it's so common. 80%, you just said, which shocks me.
Yeah.
Yeah. Yeah. And really they're seeing it used to be 25% of women experience postpartum anxiety, depression itself, or 80% was baby blues. And now, but that's actually on the rise. And so it's closer to 35% now.
Wow.
I mean, there's so many different statistics.
I'm not surprised.
No, I mean, look at the world that we live in. It's all hustle, bustle, go, no support system. Dads go back to work. Moms go back to work. There's no paid maternity leave. It's just a lot.
Bounce back.
A lot. So bounce back, girl. Where's your body? Where's your mind? Where's your...
Yeah.
Yeah. And you get 6 weeks, sweet pea, and then you better be back on it.
Yeah. It's insane.
Crazy.
It is.
I know your body hasn't even healed. So it's just, I think that you're right.
No.
I think that the part to take away from it is that education is so important. But listen, I was a women's health nurse practitioner and I saw postpartum depression every day in my office, yet I couldn't, and anxiety, and I could not tell that I had it. I was like, oh, this is normal. I couldn't see it in myself. And my husband knew I was kind of going cuckoo, but he just kind of went with the flow, okay, I'm just doing the best I can. And then it wasn't until my dad and my brother were like, this is, and they're super straightforward. And they're like, this is a problem. You have a problem. You need to get it together. And obviously that's very traumatic. But it's what I needed.
Yeah.
And so moral of the story is I didn't see it in myself and I diagnose it daily.
Yeah. It's very hard to turn that mirror around on you.
Yeah.
At any point in parenting, especially postpartum.
True story.
So
true.
Tell me a little bit about how low vitamins and minerals can contribute to a poor postpartum period, or maybe amplify your chances of PPD, PPA.
Yeah, I love this question because I think that a lot of OBGYNs miss this. I think that once you're out of that 6-week period, and And a lot of people don't even get labs. I mean, some providers do provide labs for postpartum patients, but I think unless you have a complaint, they're not just automatically ordering blood work.
I never had them done.
Yeah, exactly. And so you just bled out, whether it's a C-section or a vaginal delivery.
Yep.
You are and a lot of women are nursing their babies. So a lot is going out and not a lot is coming in. Like everywhere. Everything's going out everywhere.
Everything's coming out.
Everything is leaking, just so you guys know.
Right? Everything's leaking. And not hardly everything is coming in. It's like, give them water, give them food. But, it's true. It's like, all leaking out.
It's the last thing you're thinking about too, right? You're trying to keep your baby.
You have never been as thirsty as you will be in that first couple of weeks after
and you're sweating uncontrollably.
Yes. I mean, the night sweats, like, come on. Why?
Exactly. Just add it on.
Yep. Again, the leaking.
The leaking. Everywhere. Right? So you have to replenish the leaking is my point. Okay. Is our point, right, guys? How do we do this? So the first step is knowing what you need to replenish. And so labs are so important. So I believe that every woman should get labs at 3 months. 6 weeks and 3 months and maybe even 6 months out, especially if you're just not feeling good, or if you have postpartum depression and anxiety, or if you start seeing that coming, because a couple of causes of that or can intensify that is low vitamin D, which everybody sees that nowadays anyways. Yeah. Iron is a big one. Ferritin, really, and not just iron specifically. So a doctor will order a CBC, complete blood count, and it'll have like your red blood cell count in it, but that doesn't tell me jack. Like, I want to know what your ferritin level is.
Yeah.
And then your thyroid is a big one. So a lot of times pregnancy will take over your thyroid and it'll mess it up. You might have had underlying thyroid or maybe not. And then all of a sudden after you had your baby, your thyroid goes crazy. And so if your thyroid levels are out of whack, that's going to increase your chances of postpartum anxiety and depression. So you just need some basic blood work. Just ask for it.
And what would you suggest? So we go get our labs, everything's low. What's the best way to supplement everything? Should we go towards nutrition? Do you believe in supplements? Is it a balance of both?
I love nutrition as your number one factor. So getting whatever you're lack in, that's what you give your body food, because that's natural. You're going to be able to absorb it better. I was just watching Mel Robinson, and she had a doctor on there, and he was like, supplements don't work. They don't work. It's just placebo. They're not real. And I was like, oh my gosh, I had this argument with my dad the other day. He's like, stop telling your mom to take supplements. And I was like, I believe in supplements. And then he's over here like, they don't work. And I'm like, what in the world?
Oh, yeah.
So now I'm like,
a lot of camps on the supplements.
Yeah. You can go left, right, or center.
Pretty much.
Yep. But I will tell you is that I have clients who have very low vitamin D and low iron, including myself. And I have taken supplements and they have come
normalized
up. And I haven't changed my diet. So that's like, people will be like, oh, you ate better. I'm like, no, actually I didn't. I just literally ate. I ate the same. Yeah. So who knows? But I think it's not going to hurt to do vitamin D and iron. I think those are two really good ones. And obviously, if your thyroid's out of whack, it's usually an autoimmune or something with inflammation in your body. So changing your overall diet and doing gut health testing and just doing kind of different things to figure out why your thyroid's out of whack and why all these minerals are out of whack is probably the best thing to do.
Yep. That makes sense.
You'd be proud, Constance. I do remineralize my water every day.
I love it.
I'm on it. And I do take my iron and my prenatal. So
nice
there we go. I'm on it.
Yes. You're on it. I mean, I have lived my whole life telling everybody take your prenatal vitamins. And then you have these people that are like, oh, they don't even work. And I'm like, what about the DHA and the folic acid? I'm still going to take my magnesium and my B12. Them. Yeah, I'm taking them.
Yes, I take my magnesium.
Yeah. But I was going to say iron is very significant for sleep as well. It's something that we are always talking about in that sleep space too. So I believe in, if you come to the Birchfield family, you will see so many supplements. It's kind of
supplement
ridiculous. Supplement queen over here. But I've seen a lot of difference for myself, my kids, my husband. So I do believe that they're,
and you guys already eat really well too. So I feel if you are coming from a place of a really nice nutritionally dense whole food diet and you're still low, supplements make sense for that person.
Yep.
Right.
Yeah.
But again,
exactly.
talk to your
And you know
doctor.
what? Talk to your doctor. No, but also like those studies that he was talking about there's just no big studies. So I think that really there's just not any good studies, and the ones that are out are so small that's why he's saying that.
Right.
You know what I mean? I don't know. Yeah.
Totally makes sense.
Totally makes sense. Yeah. Awesome. Well, thanks for sharing that information. I think it's super important. So to wrap this up, do you have 4 or 5 things that you could share with our audience that they could really focus on to ensure that their postpartum period is kind of as happy and healthy as it can be?
Yeah.
You know, just is there things that we can take action on to have impact on what that experience is like for you?
Great. That's a great question. I think that I already mentioned really 2 of them. If you're going to have postpartum anxiety and depression, you're probably going to have it. Okay. Even if you prepare, even if you check your labs, even if you surround yourself with the right people, because a lot of times it's a chemical imbalance, a hormonal chemical imbalance.
Right.
Okay. But you can lessen the symptoms. You can lessen the duration. You can, you can it early, if I guess is the right terminology for it. So lab checks are always good. If you're just feeling off early, I would just ask for them. Educate everybody around you and yourself. These are the signs and symptoms. If I start to go down this rabbit hole, please find help for me. I might not be able to notice or help myself, and that's okay, right? Self-care. I am so big into self-care, as you probably anybody would know if they ever know me, is that I used to not give myself self-care, and that's why I'm so pro self-care. I used to be like, I don't have time. I don't have time. I don't have time. I don't have time. And that's bullshit talky. Like, am I allowed to cuss?
Yeah.
That was done in a very good way.
Have you met me?
I know.
True.
Right?
That is a true story. I'm like no cuss over here. And,
I'm a
2
sailor.
extra sides of the thing.
I'm like in the middle. Oh my gosh. The other day, my dad dropped something and he goes, damn it. And Micah goes, damn it. I was like, oh no, Dad. He was like, uh-oh, sorry. I'm like, oh my God. My dad is actually legitimately a sailor too. And I'm
Okay. Well, there you go. Yeah.
Free pass.
But yeah, so anyway, so I think self-care is so important, and you have to do it. You have to make yourself do it, period, end of story. And you have to do it every day. There's no excuses, and it doesn't have to be this gradual ritual that people think it has to be. It doesn't have to be an hour massage. It doesn't have to be a facial. Like, you need 5 to 10. I would prefer you do 20, but you need 5 to 10 minutes a day where you just go do something where you're not with a baby or your child or your husband or your partner. Like, you literally go take a 10-minute shower, you listen to meditation music, you put lavender oil essentials in there, and you have to do that. Then you have to start. I would start in pregnancy so that you get it's a
Used
thing
to that.
it's like a habitual. So then it leads into postpartum. As soon as the husband gets home, you take the baby for 10 minutes, honey. I'm gonna go do my 10-minute routine.
Yep.
Simple as that.
Yeah.
It is really simple. You just have to put it into your life. So that's my 3rd recommendation. My 4th recommendation is to prepare for the stressors before the baby comes. Meals. What are you going to do about meals? Huge one. Meals, because you'll find yourself not eating all day long.
Yeah. You can't fit it in.
Yeah. I mean, I was down to 110 pounds with Miles because my postpartum anxiety was so severe.
Wow.
It was not good. My dad was like, you look like a Skeletor. Like, this is bad, you know? So you have to prepare your food and nourish your body. So that's another one, I think, too. And just finding a support system that you trust, because you're right. You go inward, Paige. You don't, you start to, like, when you have a baby, there's maybe 2 or 3 people that you trust to be with your baby.
Yeah.
100%. If you're
It's
lucky.
weird.
If that, yeah.
Yeah. So
some women are completely alone. It's just so sad.
It is. So what do you do before? Like, how do you, or even now if you're postpartum, how do you find somebody, even if it's not in person, if it's just on a Zoom call for 10 minutes a day, if it's a Zoom coffee, if it's a FaceTime coffee with your friend while the baby's sleeping on you. And then the last tip is sleep.
Yeah, girl.
Shocker.
Like this one.
No one will be surprised.
Nobody will be surprised. Okay, so I'm obsessed with sleep. Everybody knows that. So is Lindsay. So is Paige.
Yeah.
I'm like, did I get my 9 hours last night? Yes, I did. Okay, listen, ladies. I know that everybody says sleep when the baby sleeps and you're never going to sleep again. And it's normal to wake up every single hour. But ultimately, sleep is one of the number one factors that will determine whether your postpartum anxiety and depression is going to be severe or not. Okay. If
Absolutely.
you can't sleep, it makes your hormones and your cortisol and your everything in your entire body way worse. And you're not able to deal with the postpartum anxiety and depression if you're not sleeping.
Yep. And what is the recommended amount of sleep for a postpartum mama, Constance?
Well, 8 hours actually.
Yep.
But you're like, but I wake up to feed my baby.
How do I do that?
How do I do that?
Well, you call us.
Yeah, that's what I was going to say. That's right.
That's a good start.
Yeah, there we go. Start there.
Or you purchase our VIP newborn sleep farm because people are like, oh, sleep training. I don't want my baby to cry. Guess what? If you do the sleep farm, it's like hardly any crying at all. It's just like
and you never sleep train.
Yeah, you don't even sleep train.
Nope.
Yeah, start early. And with Micah, my baby, well, he's 2 now. He woke up one time a night starting at a newborn. One time. I fed him at 10 p.m. He woke up around 1 or 2, fed him. He went right back to sleep, and he woke up at 6 a.m.
Go, Micah, go.
Yep.
Yeah. And you girls, anybody can do that too, right?
Yep.
Exactly. And it does significantly change your experience. I mean, both of my kiddos, early good sleepers. By 12 weeks, we've been consistent. And that saved my experience. I vividly remember with Riley that first 8 weeks, and she slept through the night very early, but still that first 8 weeks of being sleep deprived and what that felt in comparison to when I finally was getting that rest. And it just changed the experience so dramatically. And it was because I was rested. I was the best version of myself. And so was she. Right. And so it does. It really will shift your postpartum experience when you're getting that rest you need.
Yeah, it totally does. I mean, like I said, my first miles when I went into postpartum anxiety, he wasn't sleeping. I was waking up every 2 hours to feed him up until 4 months. And I was like, I cannot physically keep doing this.
You literally feel like you're dying.
You feel like you're dying. My husband would leave from work at 10 a.m. and I would be sobbing, breastfeeding him in the chair, screaming at him not to leave me. Don't leave me. Don't leave me. And he's like brokenhearted because he doesn't want to leave me, but he has to go to work. Somebody has to work. And I'm dying. And so that's why I did sleep train my 4-month-old because I didn't have any other option other than severe
Something
postpartum.
Something had to click into place.
Yeah, exactly. Right. So sleep is my biggest tip of all.
Agreed. Yep. Well, thank you for sharing your tips. Those are great. And I definitely think that they're all doable. And I would just tack onto that. You don't need to do them all at once. Just pick one of the 5, master that, and then do the next one.
Exactly. And also ask for help. If you have a partner or a friend or a mom or a dad or a sister, I don't know, anybody.
Your neighbor,
say, hey, I really need help with a meal or I need to go lay down for or can I go take a shower for 10 minutes? Can you sit in the nursery with my baby? And if you're afraid of somebody watching your baby, be like, I'm going to put the camera in there so I can see you while I'm taking a shower, but I'm going to, you know what I mean? You can always do anything. Think outside the box.
Yeah, you can always do anything, and you cannot parent without help.
Yes.
You can't do it.
You can't do it. It's impossible.
Yeah,
exactly.
So, Constance, how can we work with you? How can we contact you?
Great question. So if you go on Parenting Practice of Colorado's website, you will see there's different services that we offer, and you'll see fertility and postpartum. So if you're in the postpartum period and you just need a little extra support or help, I meet with you weekly and we go through what you need, what your body needs, what your mind needs, what your soul needs, and what you need in order to kind of get you to the other side. So I'm working with a client right now and we're doing 6 weeks together, and I'm seeing huge changes in her life overall as a parent, a wife, just self-care. So it's going well. So you just go onto our website.
Yay. And we can follow you on Instagram.
Yes. And even though it's called Constance_child sleep _expert, it's also postpartum as well in there. So
wonderful.
Yeah. Well, thank you so much for coming on today again, and we'll see you next month.
We'll see you soon.
Awesome. Thank you. We'll talk to you all soon.
Bye.
Bye.